Hey gang, Dr. Middleton here with Stonebridge Health, and I want to talk to you about shoulder pain. Is shoulder pain dragging you down? If so, if you've heard terms like rotator cuff injury or a frozen shoulder, you're not the only one. And the difference matters big time. So first up, frozen shoulder, which is medically called adhesive capsulitis. Basically, it's a term that just means that your shoulder is not moving. It occurs when the shoulder capsule becomes tight, inflamed, and restricts both active and passive motion. In fact, it affects about 2 to 5% of the general population. It's most common in people aged 40 to 60, especially in women, and it's often linked to diabetes or even thyroid conditions. Now, let's talk about the rotator cuff. The rotator cuff is made up of 4 muscles. The 4 muscles that attach on the back side of the shoulder blade, their main action is to raise your arm up to the side and rotate your arm out. When those 4 muscles or tendons get injured, you usually have most of your pain with overhead movements. But you still have movement in the shoulder, just with difficulty. Research shows that about 1 in 5 adults has a rotator cuff injury or tear. And the older we get, the more common it becomes. Sometimes people don't even realize it until pain or weakness shows up with simple activities like sleeping on that affected side or even reaching activities. So the takeaway, frozen shoulder usually equals a major loss in motion. Physically, you can't move the arm, and there's stiffness. With the rotator cuff injury, usually it's when there's movement such as external rotation or bringing your arm up to the side that causes pain. And you can have pain with laying on it or even reaching activities. The big difference, recognizing these symptoms or these signs, can really change your recovery path. So let's do a quick home test. If you can't raise your arm up all the way above your head without pain, more than likely you're looking at adhesive capsulitis or a frozen shoulder. If you have sharp pain with movements out or up to the side, then you're probably looking at a rotator cuff injury. If you have pain with throwing activities, reaching across your body, or even reaching back to grab something, that's more than likely your rotator cuff. The 4 tendons of the rotator cuff can inflame and they can start to rub. When they rub, they can start to fray and eventually tear. So that's why you don't have to have an initial injury or any specific trauma. You can have general wear and tear in the rotator cuff that can lead to a full rupture. If your shoulder pain lasts more than a few weeks, wakes you at night, or you're losing motion, it's time for a proper evaluation at Stonebridge Health. Our PT team can assess what's going on, create a plan, and help you recover function and get back to full range of motion. Don't wait until the stiffness or pain become a life-limiting issue for you. Book an evaluation today, and I look forward to seeing you.